My name's L. Ryan Smart. I'm a sports medicine specialist at St. Joseph's Hospital. I did undergrad at Cornell, and then I went to the University of Michigan for med school, and then I did my residency at Yale, and went to Boston for a year of sports fellowship at New England Baptist Hospital. I thought I was going to play hockey, and it was an orthopedic injury that ended it for me. So, and that's kind of the reason why I went to a good school, that you have Plan B. You know, I cheated a little bit. My dad was an orthopod as well, so you know I had him, and then you know, playing hockey, you break a few bones along the way, and pretty much if you're an athlete and you go to med school, it's hard not to become an orthopedist, to be honest. So it's a good fit. It was a total package for us. I mean, it was St. Joseph's, it was Syracuse, and it was SOS. And you know, I've been all over the place at big places in Boston and at Yale, and they're doing it as well as anybody, anywhere. And that's the truth. The people there. I mean, I've come across employees at St. Joe's that are there to make your life better as a surgeon, which that doesn't exist too many places, you know, and that really struck me right from the beginning. And when I came up here, that was very attractive, knowing that you're going to be positioned in a hospital where you're going to be taken care of, and things are going to go well and go smoothly. Being a surgeon, you tend to think that, oh, everything's going to go great, patient's going to be in the hospital and be out no problems. But if things go wrong, you want to know that you have experts in all fields there that are able to take care of them, and the best. And we have that. Particularly, you know, cardiology at St. Joe's is extraordinarily strong, and obviously if somebody, and it's not uncommon after an orthopedic procedure in an older person for that to be an issue, and you want to know that you have somebody there that's, you know, top-notch, top-trained, that again could probably be anywhere in the country practicing, but they're here. That's very comforting. We cover a lot of local high schools, some of the local colleges, and their athletes. And again, I think being an ex-athlete and getting to a reasonably high level gives you an advantage to take care of these kids, because you were there, you know, and if you were ever an athlete, chances are you were hurt, you know, and you were on both sides. So it's a great opportunity to, again, kind of get back to the community, but at the same time, you're meeting people and taking care of their kids, and you meet families from A to Z. So that's been a great opportunity for me. I mean, mostly at the high school level, we're chipping away at the college level, but you know, to get to the, you know, the kids that are really into the just lacrosse and football and the hardcore sports. So it's been really cool. I try to treat most people, honestly, like they almost are a family member. You know, if you're always thinking in that mindset, you'll be right with patients. You know, I think when you lose that and you start treating like somebody like they're a number or nothing, so for me it would be kind of easy. I mean, I would just treat them like almost any patient I have, which I kind of try to treat like whether it's my mom or my brother or my sister, and just talk to them and tell them what's wrong with them, and this is what I think will be the best thing for you, and just make it happen. So it's, you know, again, it's kind of, I think, easier for me, because again, my dad being an orthopedic surgeon, he's operated on me, you know, and I know some orthopods don't want to touch their family, but I grew up with, well, that's kind of how you treat people, like they're your family. So it's I think some ways for me, I think it's easy, because I try to treat everybody like that.